Good afternoon, everyone. Welcome and thank you for joining us today. Today's webinar, Eat, Drink, Thrive, Strategies for Successful Dysphagia Management, will be presented by Owini Lee and Janice Duvestein. I am Erin Bailey, Medical Affairs Manager with Nestle Health Science, and I'm your moderator for today's webinar. Today's webinar will include a case study presentation and will offer practical strategies for dysphagia diet modifications, meal fortification, proper positioning, and tailored interventions to enhance the mealtime experience and meet the nutrition needs of individuals with dysphagia. At the end of the webinar, there will be time for questions, and you can enter your questions into the Q&A box to the right of your screen. We also have poll questions throughout the webinar, which you can access to the right of your screen. Once the recording of the webinar is ready, you will receive an email that includes a link to the recording, a one-page summary of key takeaways from the webinar with a list of resources, and a certificate of attendance. I am honoring the land we are presenting on today. We respectively acknowledge that Nestle offices across Turtle Island are located on the traditional treaty and unceded territories of First Nations, Inuit, and Métis people. Indigenous peoples share a sacred relation with the land, and this acknowledgement is only the first step in learning more about our history and taking action towards reconciliation. I would like to introduce our speakers for today. Owini Lee is a registered dietitian with over 20 years of experience. Owini currently supports clients with developmental disabilities, focusing on dysphagia and home enteral nutrition in her home care role. She co-chairs the Dysphagia Assessment and Treatment Network at Dietitians of Canada and serves as a clinical instructor at the University of British Columbia, where she leads workshops on enteral nutrition and dysphagia. She also contributes to various interprofessional dysphagia initiatives at UBC. Jan is a combined trained therapist, OT-PT, with over 30 years of experience in eating, drinking, and swallowing. She works at Access Community Therapists, providing dysphagia consultation services in British Columbia. She's an associate clinical professor at the School of Occupational Science and Occupation Therapy and a member of the ITSE Board of Directors. We are very excited to have Owini and Jan leading the discussion today. And now I'll turn it over to Jan and Owini for the webinar.
All right. Thank you so much, Erin. Welcome or good morning or good afternoon to everybody. Thanks for being here for our webinar. And I'd like to just do an acknowledgement as well. Owini, if you could, thank you. Owini and I are very privileged that we live and learn and play on the unceded, ancestral, unceded and stolen territories of the Musqueam, Squamish, Tsleil-Waututh, and Coquitlam nations. So when Owini and I were sort of putting together and thinking a little bit about this presentation, I think one of the things we both, we work together in community, and one of the things we both really wanted to do was sort of frame it in the context of real meal time. So we talk about dysphagia, and we see that often from the medical side and the health related side, but we really wanted to see it, or at least frame it in that. And I think we found that this little comment by Dorenzo really captured a lot of the feelings about it. And part of this is just that oftentimes we make our recommendations, but they don't go very well because we're missing the piece that is really most important to the clients and families that we serve. So we'd like to put that in the background there. So, of course, when we look at the different aspects of it, we obviously want to have our client in the center of it. And we're, as health professionals, very concerned, obviously, with health and safety and so forth. But I think we need to be very aware of the importance of all the other aspects that contribute to this sort of the whole assessment and management piece. So what do we have? We have a toolbox. And within our toolbox, we have a number of different different strategies that we bring to the table to work with the client and the family in terms of meeting their needs. Now, for today's presentation, we're really going to focus on sort of some of these more direct strategies that help compensate for the issues that are at hand. We are very aware there is a number of other strategies, rehabilitative ones that might be brought in, and some of you may be involved in those. But for the purpose of this one, we're going to focus on some of these more sort of immediate things that we can do. So we're going to introduce you. Please meet Harry. Harry is a 70-year-old man with getting a fairly advanced stage 4 Parkinson's disease. He's still living at home with his wife, Sally. They're managing, but things are definitely getting a lot harder. So just to give you an idea, these are some of his medications that he's on, and it's always really good to have a good look at these because they give you a little bit of the story as well, what other kinds of diagnosis there may be, and we'll talk a little bit further about the medications. We can see that Harry is certainly fairly well poorly nourished, and there's some definite big concerns here, and Winnie's going to really get into and address some of those issues. From the physical perspective, the whole physical changes along with the Parkinson's and some of his other health issues are beginning to have a great deal of impact. And you can see just in terms of mobility, how that's affecting his eating, his getting and moving around. But we're also seeing cognitive changes. So we're beginning to see some of the dementia pieces settle in, and he's also experiencing some vision issues. So from a safety concern, as the therapist coming in to do the assessment, the big red flags coming up for me is just he's had a number of choking incidents, and that is obviously a real red flag because his risk of further choking incidents are going to be higher by nature of this. His reduced oral skills, his difficulty chewing and managing and controlling food in his mouth is contributing to the safety, but also efficiency. At this point, he's not showing a lot of signs of aspiration. There hasn't been any respiratory illnesses, but at the back of my mind, as we're doing this assessment, I'm very aware of that as being a potential issue down the road. So we have a toolbox, and the way we're going to frame it is we're going to think about the strategies, because we're really focusing on strategies here today, is things that we're going to take care of or think about before even getting to the mealtime, things that can happen during the mealtime, and then things we need to think about after the mealtime. So just to get you guys all thinking as well, based on what we presented in regard to Harry, we'd like you to take on this poll and just think a little quickly about what are the immediate things that came to your mind as I was reading through and we were showing you the picture of Harry. The poll should be over to your right, and you have a certain 45 seconds actually to do the poll. So we're going to give you that time just to see what comes up from there.
There are so many, there are so many issues that need to be dealt with in this situation. So I'm just curious to see what's on your mind. All right. So most of the people so far are voting for recommending oral nutrition supplement. It's really exciting for me to see the bar going up and down, like people voting for a certain candidate. We have next in line, we have downgrading the food texture and then trying a weighted spoon. Definitely the majority of people are recommending oral nutrition supplements. There are some people who would choose to maybe try thickened fluids and trying to get the caregiver to feed Harry. But yeah, for sure, I think the winner here is recommending oral nutrition supplements. Now, there's no right or wrong answer, right? And they're all like good options to think about. And like I said, there was just so many issues to deal with here, but maybe let me walk you guys through our approach where we identify some actions and intervention for each of the phases that we identified. The thing is, it all really starts with before the meal even takes place. It is quite well established that dysphagia is very closely linked to malnutrition and dehydration risk. Harry's dysphagia can cause him to eat and drink less. His reduced intake results in malnutrition and dehydration, as we know, which then can really weaken his muscles. And that includes the muscles involved in his holding his posture and the muscles involved in swallowing. So all these factors combined can really lead to worsening of his dysphagia. And that really creates this vicious cycle where the worsening dysphagia can worsen his malnutrition, and then so on and so forth. If we're able to stop this in the track right here, we can really have a potential to improve Harry's health, safety, and quality of life. So the first step in breaking this vicious cycle is meal planning. When I say meal planning, I'm not only referring to what food you're serving, but also what can be done to maximize the nutrient density, how to modify the food texture properly and serve it in a way that's enticing. Because getting the food right is really important to improving Harry's eating and drinking, which in turn can improve his nutritional status and overall well-being. First off, we have enhancing the calories. We can choose foods that are naturally higher in calories. We can also fortify all his foods with extra calories. For Harry, he probably doesn't need pureed food at this point in time, but if we ever need to puree foods, we need to watch out as to how much liquid we're actually adding to the pureed foods. It's important to be aware not to add too much extra liquids, which can dilute the nutrient density of the food. If we need to increase the caloric content, using higher calorie food fluids such as like condensed soups, sauces, gravies, creams, cheese sauces, etc., can also help to add moisture, but also maximizing calories. And for Harry, because he's lost so much weight, as you all pointed out, he will likely need to use an oral nutrition supplement to support his weight gain. And most of you, I believe, are dietitians here, so I'm sure you're very familiar with how to add calories. So I won't go into very much details here. As you can see in the picture, it's our usual high fat, high protein, high calorie additions. But I also want to let you know my recent favorite is avocados. One avocado has 250 calories and 13 grams of fiber, so it can it's a dual purpose tool for me here. And also it's super versatile because of the flavor. It's quite neutral. If you don't want to worry about having a bunch of fresh avocados sitting and staying greens on your counter, and then for them to ripen all at once, you can consider having some frozen chunked avocados in the freezer. They don't do very well for salads and stuff, but to add to smoothies or soups, or even turning into creamy sauce or pastas, they're excellent to keep on hand. If you're into baking, you can also experiment using avocados instead of butter or oils in baking to further increase fiber content. So next up is protein. We definitely, of course, want to increase high protein foods that are like meat, fish, poultry, eggs, legumes, dairy. I've also started to recommend the ultra filtered high protein milk here in this little corner here. Unlike adding protein powders to a milk, it doesn't change the flavor profile of this product. It tastes just like milk. And then it's also only about $6.99 for a 2-liter carton in this day and age. So I think it's a really economical way to boost protein because it can be used as a beverage and it can be used as an ingredient as well. But of course, we can still fortify protein by using protein supplements. For example, we can use whole milk or skim milk powder. We can use commercially prepared whey protein powder. There are also lots of choices for plant-based protein powders, such as like the hemp-based powder here, and then the pea protein-based protein powder here. There are lots of options these days for sure. And then if you don't want to rely on powder, we can also use pureed legumes as a way to thicken foods to further boost the protein content. And another way to increase the protein is by using tofu. So for sure, like extra firm tofu here and then the firm tofu here, these are excellent choices to add to recipes, right? To enhance protein content because they're naturally quite high in protein. But because of the firmness of the product, they are not sometimes ideal if you need to mince or puree the food. Sometimes they can get a little chunky. So if you're intending to texture modify further down, so soft tofu like this or like the silken tofu in this little tub here, these are quite good options to add protein to your pureed and to your liquids. Another way that you can consider is maybe baking with some almond flour instead. Substitute some regular flour with almond flour. For example, 1 cup of almond flour gives you 32 grams of extra protein, which is not too bad. And next, we are going to talk about fiber. And I know fiber isn't exactly directly related to nutritional status, but if Harry doesn't feel like eating because if he's backed up, as we can see in the case study early on, that he doesn't have very regular bowel movements, which is a common problem for folks with Parkinson's disease, promoting regular bowel movements can really make a difference in improving his appetite. So here are some of the foods that we can serve more of to increase the fiber intake. Softer whole grains such as oatmeal, cream of wheat are really great for texture modification if required. Fiber-rich fruits and vegetables such as squashes, peas, pears, apples, avocados, Brussels sprouts, sweet potatoes, spinach. These are all high fiber sources that also work really well with texture modification. Pureed vegetables can also be used as a sauce to enhance not only the visual appeal, but also to add fiber as well. And then, of course, we can also try adding fiber supplements like ground flax seeds, psyllium husk, inulin fiber, and chia seeds, etc. Or again, using almond flour as a substitute, oat flour or whole wheat flour in baking if you are a home baker. Of course, we know if we increase fiber, we got to increase liquids. For Harry, because of his mobility issues, he really doesn't like to get up to use the bathroom and he doesn't want to drink at all. To improve hydration, it is important to offer a variety of choices that appeal to the person you're supporting. If they don't like to drink plain water, because especially room temperature water, because it's like there's nothing, no taste. So flavored water that's infused with, say, pureed fruits, cucumber, herbal tea, if they prefer things warm. These are all really good alternatives. And for icy cold drinks or warm drinks and beverages that are tart, they can provide also extra stimulation and sensory input. And for people who have dementia or have sensory loss, these like changes in sensation can really perk them up and not only increase enjoyment, but help to improve their ability to handle those textures and in their mouth as well. Now, if they really don't like to drink any fluids, we can also try offering foods that are naturally very high in water content, such as cucumbers, zucchini, watermelon, strawberries. These all have over 90 to 95% in water content and could be a valuable inclusion to increase their hydration level. As for thickened fluids, there are some recent discourse on its use. We won't be discussing the details here, but we have included some resources in our handout that talk about clinical decision making. But if thickened fluids is deemed appropriate, then it is really, really important to make sure that the mixing instructions are followed accurately. It's one of the most common issues that Janice and I run into when we do our assessments. Has anybody seen this in your practice? I've seen definitely a lot of this. So we have our famous lumpy water and the grainy milk products, because thickener products are fantastic, and when they're used well, they can give you really nice, smooth products that are not too bad to drink. But if they're not done right, this is what you see. And this really puts a damper on people. They don't really want to drink things that don't look quote unquote normal and appealing to them, right? So getting the caregivers or the family members to practice hands-on, we find is a great way to ensure that these drinks are prepared properly. And in certain situations, having a free water protocol can be appropriate to improve fluid intake. I'm going to turn it over to Janice to discuss what we actually are going to recommend for Harry.
So with the assessment and sort of working together with Oweni, we talked through where was Harry, and essentially Harry's skills are at the place, and because of his muscle weakness and so forth, he's not doing that well. And one of our goals is obviously to reduce choking risk, because that's scary and potentially it can have a very bad outcome. So minced and moist texture seemed to be the most appropriate, and Harry did indicate it was easy for him to swallow. Clinically, it was obvious he could manage it a little bit better. Sally wasn't super happy about this. She felt a bit uncomfortable about it. So one of the ways we often will try and help families or caregivers understand a little bit about, textures and how we work with them is to use the IDSI framework, and then explain that, we all eat throughout all of the different texture and levels and drink consistencies. We all eat puree foods. We have yogurt, we have liquidized cream soups, etc. And so what we're doing in the thing is making a recommendation around the outer boundaries, and that Harry would be able to have everything else on the in-betweens of these, and that therefore expands his variety. So everything doesn't have to be just one particular texture. So just sort of trying to explain that it's not outside the realm. This isn't absolutely special. We all eat these kinds of foods. And Winnie's going to talk a little bit more about some of the texture choices and that you can do. One other thing that we had a little discussion with Sally about is that maybe if she's concerned about the chewing part, we could introduce some transitional or meltable kinds of foods that could be used for Harry, just to give him a little bit of crunch. We're going to be less concerned about the choking at this part. Right now, he is managing with some thin fluids. We're trying to maintain him on thin as long as we can, but we also know that we may need to make some changes along the way for that.
All right, so let's switch gears and talk about texture modification here. So when it comes to texture modified diets, we want to encourage normative foods as much as possible before we go ahead and modify the texture of their meals. For example, serving things like a saucy shepherd's pie for mince and moist for Harry, instead of mincing a sandwich, is probably better. And then serving naturally pureed foods such as mashed potatoes, like puddings and butternut squash soups, pureed soups, things like that would also be preferred. And according to this meta-analysis that was just recently published in February, texture modification in itself can lead to an increase in calorie and protein intake with adults with dysphagia. But people don't always follow through on texture modification recommendations. And like Janice mentioned, there are many, many reasons. So there could be denial, taste and texture preferences, cultural and psychological factors such as embarrassment or stigma, especially if they have to do that in public. And family caregivers also may not fully understand the need for texture modification, or sometimes they don't have the knowledge or skills to prepare meals in these textures. So which is very important for us as professionals when we go in and do the assessment, is to ask more questions to try to identify what the real barrier is and address some of these potential barriers to help make this a success for everybody. So now let's look at what your thoughts are when it comes to texture modification. We're curious to see what you typically discuss with your clients in your practice these days in terms of texture modification. So do we just talk about the diet? Do we just talk about the texture explanation? Or do we discuss the equipments, cooking methods? Or do we teach them some specific tips or tricks? Or in your practice, you just haven't had the chance or the time to discuss these with your clients? All right. So most of you talk about the texture recommendation and what the textures mean. And then some of you go into more specific details about the equipments needed, which is awesome, and the cooking methods, specific techniques. And some of you don't really have the capacity to talk about that at this point in time. Yeah, excellent. So most of you really explain the textures and the equipments needed. So that's awesome. That's awesome. So hopefully what I'm going to share in the next few slides will help to fill in some of maybe the knowledge gaps. And hopefully you'll be more confident in discussing this with clients if you have the time to do so. Because I do think that this piece is really, really important in ensuring that the compliance is there, and then the people are the clients are enjoying the food as a result. All right. So I'm going to share some of my tips. Is we have to look at the right food, the right equipment, the right cooking method, and the right technique. It could be as simple as just using a knife to cut up some larger piece of meat, but it can also be more tricky, like mincing or pureeing. So for the following discussion, because those are trickier textures, I'm going to be focusing on mincing and pureeing because they are usually the more complicated pieces. So to start, we have to start with the right foods. As some of you know, some of the foods just don't modify very well. It doesn't matter what you try, such as sandwiches and salads, for example. And so maybe like not trying to serve those, or trying to maybe reduce the number of times that shows up on the menu, unless the person really misses them and really wants to eat them. So for example, for meats, we want to select more tender cuts, such as like sirloin, strip loin, tenderloin, and these are more tender cuts, and avoid cuts that include tendons and like the sinewy bits that can be harder to work with. Now, contrary to popular belief, ground meat aren't always better or easier, because it can get lumpy and have tough bits that are made of like ground up cartilages and things like that. So they aren't always ideal. If you have to choose tougher cuts, not to say it's not allowed, like flying steak or chuck roast, things like that are a little bit tougher in general, but you just have to focus on cooking them properly to ensure that they're still nice and soft and easy to chew and manage after they're done cooking. Starches can be particularly problematic because we know that they are sticky. So when starchy foods are heated in water, the starch granules absorb the water, they swell, and then they eventually burst and releasing the amylopectin into the liquid around, making it really sticky. And then when you work this mixture further by pureeing, like by putting in a processor where it's more starch is going to be released, and then things are going to get sticky and gummy, and next thing you know, you have a gumball. So choosing something that is naturally smaller, like a pasta such as, like, say, orzo, for example, it really reduces your requirement to, say, mince up a spaghetti, right? So try to find foods that work better for your texture instead of trying to modify everything that you see on the menu. And for fruits and vegetables, avoid stringy and fibrous vegetables like celery, because they really don't work really well. Or fruits that have little seeds like, blackberry, those never go anywhere. It doesn't matter what you do. And fruits and vegetables that have skins like tomatoes, bell peppers, those are also best to be avoided. So here, choosing the right equipment is very important, and they're sometimes overlooked. Different tools have different purposes, and we want to choose the right one for what we want it to do. For cutting and chopping, a really sharp knife will often do. You can even mince if you're really good at knifing skills. Food processors have an S-shaped blade and they're flat. So they're designed to chop and to puree, pulsing for chopping. And then if you sustain it on, it will puree. And they work especially well if you don't have a lot of liquid in the mixture. And then because the barrels are straight, it's also easier to scrape out the food as well. So that makes your life a little easier. Blenders, like, the Vitamix or the Blendtec, those blenders, on the other hand, they are taller and they have different blades. Their blades have more prongs and they point upwards. So they create this whirling effect around them. Although you can also puree foods with the blender, they tend to work better if you have more liquids. And if you're only making food for one person, having a big blender or food processor sometimes don't work, because you just have the food whipped around the wall and they can't get to the plate. So having a smaller equipment like, the Magic Bullet or like a NutriBullet can help you have more contact with the blades inside the container and will give you more uniform results. Also, another tip is that hot foods, they puree better than cold foods. So when they're fresh, you really want to modify them when they're nice and freshly cooked. For people who like to go out and enjoy restaurant meals, having these tools on hand sometimes can help. And they're great to include people in your outing and increase that social element. And so they don't have to feel left out and they can enjoy the restaurant meals as well. Now, let's talk about the right cooking method. When we cook the food, we have to keep in mind that the food have to be modified later. So while certain textures we enjoy, like, the crispiness and the crunchiness of certain foods in dry heat cooking method, deep frying or like an oven, we love that texture. We just have to keep in mind that these don't turn out very well when you modify them. Moist heat methods, for example, like simmering, poaching, slow cooking, can often prevent the meat fibers from shrinking too much and becoming tough. And the moisture also helps to soften vegetables and make them easier to process later on. High heat versus low heat. Of course, lower heat for longer time is preferred, such as in the crock pot, or if you have pressure cookers or like Instant Pot, like something like that, can also result in softer foods that become easier to modify later on. We also, of course, don't want to overcook the food, especially the proteins, because once the muscle fibers shrink and become tough, it doesn't matter how much liquid you add to puree, it's not going to bring it back to life, and you'll have a texture that is weird and like a bit lumpy, and so that should be avoided as well. So this is what I'm talking about, cooking in moist heat. So this is exactly the same cut of beef that we purchased. It was a piece of tenderloin. And when we slice it nicely and thinly and cook it in a gravy, a sauce, and you end up with a piece of meat here that is very nice, soft, and it can be cut easily with the side of a fork. Same piece of meat, high heat, cooked for a long time. You see how it's like kind of dry and dead, and you can't cut it. So it's not a surprise that this piece of meat that is cut with a moist heat method can process much better than the dried piece. And here's what I'm trying to say about the ground beef. As you can see here, you know, there's like a lot of bits that are thick and chunky here that don't blend down very well. And on the right side here, it's actually the same piece of meat that we cooked earlier in the gravy that is nice and moist. We put it in the magic bullet, add a little bit of gravy, and then we just pureed it down, and look how nice and smooth it is. So it makes a huge difference when you employ the correct technique to process your food, and then it will result in a product that is much tastier and more likely to be accepted by your client. And here are just some troubleshooting guide for some common problems that we encounter. For starches that are too sticky, you really want to cook them in a lot more water than you normally would. And then also adding just the right amount of liquid to the mixture, but not too much. We wanted to not dilute it overly, right? We wanted to get it just right. And then adding a little bit of fat can really prevent it from sticking together, because the fat can coat the starch grain and prevent the bond from forming and turning it into a really glommy mess. So if it's too runny, I know that sometimes people add too much liquid when they texture modify, and then it becomes too runny, and then they thicken it with the thickener powder. So that's what we're trying to avoid by not adding too much liquid to begin with. But sometimes there's just too much watery veggies in there, and it does become too runny. So in that case, of course, we can use commercial thickener. We can also use natural thickening agents such as like instant potato flakes. There are baby cereal flakes that you can use they're quite flavor neutrals, maybe slightly sweet, and some of them are even iron fortified for you if you want to increase the iron content, and you can add those to naturally thicken the food. If they're too dry, adding flavor compatible liquids is important. You want to add sauces, gravies, yogurt, cream, whatever works for the flavor for your dish. I see a lot of people will just fix it with adding hot water, and please don't do that. At least we want to make it a bit tasty, a bit more flavorful if you have to fix a product that's too dry. Right, let me show you a little demo here. So this is my half a cup of rice mixed with half a cup of water, and see how sticky it is. Like it's not meeting the requirement for the spoon tilt test for sure. And here's how I fixed it. I added a cup more water, and then I added 3 tablespoons of oil to it. And you can see how much smoother and how much less sticky it is. And so this final product will meet the spoon tilt test requirement. So finally, for before meal, we have to look at these medication, and one of them being levocarb. And let me just screen share again. I think my screen sharing might be off for now for some reason. Let me see what happened here. Yeah,
I think it's okay.
Oh, it's okay.
It was on.
My apologies. It wasn't showing up on my screen. Here. Okay. All right.
So I'm not
we can see it, right?
It's not. There we go. Okay, it's on again.
Okay. Apologies. So before the meal, so back to talking about medication, because the levocarb has a very specific timing requirement, and it's often taken multiple times a day. I've seen clients that have to take it like up to 4, 5, 6 times a day as their disease progresses. So it becomes really important to time these medications with their medications well between the meal times if possible, because this medication interacts with the protein in meals, making it less available. It is recommended that you take the medication at least 30 minutes before you eat a protein containing meal. So spacing is important. Not only does it help to improve the overall absorption of the medication, it can also make the medication more effective for your mealtime to reduce the symptoms of rigidity or like tremor that can affect the mealtime experience as well. So if you have to time it 30 minutes before the meal, or about an hour and a half to about 2 hours after the protein containing meal would be ideal. So now passing back to Janice again.
Okay, so I think some of the other things that we need to think about is what the environment is around the meal. And on my visit with Harry and Sally, Harry was sitting at a table, sitting in the sunshine, but the sun was beaming in right into his face, and we know he's got cataracts. He's for a lot of older people. I'm now in that category. Glare is a real problem, and it can make it very difficult to see. So lighting is really something important to think about. And certainly that was an easy fix. Brought the shade down a little bit on the window to reduce the glare. You can change the person's position in that. The other problem was that Sally had the TV on very loud. She's a little bit hard of hearing, which is, again, another common thing that happens. So those kinds of things can cause a lot of distraction for people. And particularly as we know that Harry's starting to experience some of the cognitive changes, those confusing, noisy, distracting environments are not always going to be the best for people who are struggling a little bit to understand, what the task is and where they're supposed to be. So those are often fixes that you can do reasonably easily and make changes, but you need to be aware of them. A level of alertness is something we run into quite a lot, and I'm sure many of you do too. Dementia, medications, and fatigue are very common problems that happen. We always say to our caregivers, if the person's not alert and actively moving something in their mouth and their throat and actually swallowing, then there's no point in putting food in there. It is just literally going to sit there in their throat, and that will put them at a very high risk of aspiration or choking. So looking at the alertness pattern, we know with dementia, sometimes the person might be great when you come to see them, but you need to find out towards the end of the day, how are they doing then? And there are some strategies you can use, such as touch, verbal cueing, washing the hands and face, or sometimes even use of a toothbrush just to do a quick wipe around the mouth. That actually jazzes the system up and helps provide the person with a little bit of alerting to kind of get them ready for something that's about to happen. If none of those things happen and you really need to, then changing the meal schedule. And we talk a little bit to caregivers about look for windows of opportunity. When is that person alert? There's no absolute rigid rule that says you have to eat your dinner at this time and that's it. Think about having a little bit of flexibility in that. So during the meal, there's a number of strategies that we look at. And as a therapist, one of the big things that I'm often really looking at is what is the person's position and posture. We know certain head postures can increase our risk for having things go down the wrong way. We know that a lack of stability can make people have difficulty holding it there, can be very fatiguing. So looking at Harry, when I came in, he was sitting in a very heavy, straight back wooden chair with slats on the back. He couldn't move it up into the table. It was quite heavy. He was trying, because he's got a rounded shoulders or a kyphotic posture through his upper spine. He was rounding even more to reach the table. And what was happening was, of course, with his tremor, the food was a lot of it was hitting the table and hitting his lap and not actually making it to his mouth. So quick fix. We moved him up to the table very quickly. We got him close by, and a lot of older people, no elbows on the table were what you were brought up with. Well, I'm a great proponent of elbows. Yes, please, elbows on the table. It can provide a lot of upper body stability and help prevent leaning and so forth. The rounded shoulder posture, which we see a lot, especially in an older population, the problem with that is often when you're going to eat, and particularly when you're about to drink, you can see the neck ends up in an extended head position. Next slide. And what we know about an extended head position is that it changes the relationship between some of the anatomical structures in the throat area, which therefore can change some things in regard to swallowing. All of you can take a look up and do a little swallow with your head in an extended posture there. So some of the simple ways we can do, and particularly with people who are still ambulatory, is just look at the type of chair. You can have an open angle chair, and you'll see on the lower red lines here that it basically opens the angle of the hips and the back and accommodates that rounded posture and brings the head into a more upright position. The other thing is that an armrest can provide a little bit of that lateral stability for people, so that if they're leaning, you can sometimes put in some foam or supports to bring them up into a more upright position. So those are some strategies. You may need to bring in, a therapist if it's a very complex, high tone kind of situation. We also have mealtime equipment that we can use. Next slide. So little things to think about. Simple place settings. Don't clutter up with a lot of additional stuff, and get some contrast in there, particularly for elderly population with visual problems. Brightly colored plates are often recommended for people with dementia in order to try and help them be able to see it and to realize what's actually going on. The other thing we want to do is also prevent our dishes from sliding around the table, because there's nothing worse than chasing your food and not really catching it. And the shape and type of plate or dish that the food's being served on. Harry had a very deep bowl because his wife thought, well, it's easier for him to get it out, but he's lacking some joint movement in his hand. He doesn't have the fine motor manipulation, and so he was actually having a hard time getting out of a very deep bowl. So a slightly more shallow style of bowl with a lip on the edge can be a really useful type of thing. And that actually worked out much more successfully for him. And our next slide, we're going to look at our different drinking options. And you'll notice we're showing a lot of fairly common commercial things that you can just buy, regular dishes. There are lots of options out there. In Harry's case, he was having trouble because he had a tall, narrow mug, and he's got a rounded, fixed posture in his spine, and he was only drinking half of his drink. So just by going to a shorter, wider mug with a handle that had a little bit of weight to it, he was actually able to get closer to the bottom of his cup drinking like that. So those are simple fixes that you can use. Straws, we do use straws, and some people have great preference for them, and they can be useful. You do need to assess it. Some people are not that safe to use them. So again, it's using clinical judgment and checking those things out. A lot of people are aware of adaptive equipment and will rush off and get these. They can be very useful, and if they work, they may be a very good option, particularly large handles on forks and spoons. But they can also A, be expensive, B, get lost, and then they're really expensive because you've now had to buy them twice, and C, for people with more cognitive issues, dementia and so forth, they're often very confusing because it's not familiar. It's not what they're used to. So they are things that you may want to use, but I wouldn't rush out the door and use them as my first line. I would try some other options first.
Right. So Janice touched on the contrast piece for presentation for people with dementia, but just looking at these like food here with like very bland color and bland presentation, it is definitely not appetizing. So if you're not wanting to eat it when our appetite is good and when our health is good, the person who is not feeling too well and appetite is down is definitely not going to like to eat something like this. So with a little bit of creativity, we can make them look better. And the main thing really is utilize the colors. The vibrant colors are very important. Say for Harry, he has cataracts. So something that he can really see with the contrast between, say, like the green and the orange here can really help him look at his food and make everything looks so much more appealing. For the salad here that I try to do up, instead of pureeing everything together, I try to separate the tomato out from the greens and then add it back into the bowl to create a bit of contrast, even though it is still not ideal, but at least it's not like some kind of indistinct brown grayish mush that is in the bowl. And also another strategy is, if you're not able to get molds, or have the time to play with molds in your practice or in your setting, having them served separately into little bowls can really help and enhance that appeal, visual appeal. The other thing is, if they are okay to be eating a transitional food, sometimes like serving a transitional cracker with like a non-sticky kind of dip can really give you that normal sense of eating, but still being safe and appropriate. The other aspect is definitely enhancing the sensory appeal by using flavor and aroma. When we get older, the taste buds decreases and they also shrink in size. We also don't produce as much saliva, and our sense of smell also diminishes with age. In Harry's situation with his Parkinson's, and for some of the folks dealing with long COVID, there is still a reduction of smell as well. So really increasing that aroma can really help to bring that appetite back. And to counter this, we can use a lot of herbs and spices to enhance the flavor and aroma. Cinnamon, nutmeg, and ginger can also add a layer of warmth to both savory and sweet dishes to bring out that nice dimension of warmth. And then the other trick is that if you have onions, garlic, and ginger, if you saute them right before you add them and puree with the vegetables and meat, that can also enhance the aroma and make it much more enticing. And finally, again, make sure you use a flavorful liquid if you need to add this to your texture modification.
So the other thing that we're able to do is look at or play around with is around the duration of the meals, looking at that. A lot of older people, they don't do that well with large volumes given sort of 3 times a day. So smaller meals given more frequently. This is also for Harry is going to help him both with his fatigue and sort of keeping his interest and so forth, as well as with his reflux. The other thing that's really important is we want to keep people independent with their eating. It is better that they are feeding themselves if at all possible. You may have to balance this with efficiency if they're taking a long time. So things like hand over hand or hand under hand can help to maintain that sort of feeling of a level of independence for that individual. The other thing is with dementia, that whole pattern of, scooping the food up and bringing it to your mouth, it's a very ingrained pattern in people. And so if you can maintain that kind of pattern of movement, that may certainly help in terms of keeping the whole eating and swallowing action going throughout. Next slide.
So this is the last piece during the meal. It's last but definitely not least, because it's important to socialize. The word companion originates from the concept of sharing a meal, and it literally translates to with whom one eats bread. So it's really important to keep the social aspect going. And it's actually proven in research time and again that when people eat with friends, family, or even just people, they eat better, and that results in higher in protein and energy intake. And the social aspect is actually so important that the ESPN practice guideline for geriatrics recommend that older people with malnutrition or at risk for malnutrition should be encouraged to share their mealtime with others to stimulate intake and quality of life. So I'm sure with that, I'm sure Sally wouldn't mind joining Harry for his meals to help him eat better.
Okay, so we do need to think about after the meal as well, and not just the meal, because things happen after the meal. So a couple of things to consider. One is that we know Harry has reflux, and one of the things that was happening was because he was so tired after eating this long meal, he was going and he was lying down on the bed, and his bed was flat, and guess what? He starts coughing and burping and being really uncomfortable. So we worked with him and Sally to come up with another solution, which was to use his lounge chair where he could still recline a certain amount, but still kept his torso in a more upright position. And that was helpful for that. The other thing is oral care. We know I think we've all become a lot more aware of the importance of oral care and the links of bacteria in saliva being aspirated and causing pneumonias. And so it is important to do that. Oral health, just for even being able to maintain chewing function. And also because as dementia progresses, we know that if food is getting pocketed and then people go and lie down or are reclining or suddenly fall asleep, even sitting in their chair, that they can end up with that food going back in their throat and being aspirated. So all of those reasons are good reasons to get into the pattern of providing extremely good oral care after the meals. So we don't stop there either, because this is a little bit of a journey we're having with Harry and Sally, and we need to look down the road. There's some clear flags for follow-up here. We know that his weight has been very low. That's been a real problem. We're very concerned about it. It's impacting on everything. If you remember that cyclic picture that in the slide of when he presented, we need to do some follow-up to see if the interventions we've now put in place are actually helping improve the outcome for that. We also want to make sure that he's gone to the doctor. We've got the medication and looked at and been adjusted, and to see, has that made a difference? Because you know what? I mean, maybe Harry has made some improvements, and we can look at bringing in some soft and bite-sized foods into his diet, so we can do a little bit of expanding for his quality of life. So those are important things that we want to do. Education is a really, really big piece of that, and I know some of the questions that came in from everybody, thank you for those, is how do you get families to sort of understand and get on board? And it is taking a bit of time to put into doing some education, but I think Oweni and I feel it's really worth it. We do a lot of very practical. We have a little sort of talk a little bit about swallowing and issues, and then we do a lot of practical activities with the caregivers and families. We get them to actually choose some different types of textures, ask them to think about what that feels like in their mouth. Can they swallow when you only chew at once? We get them to food test a whole pile of foods. So actually getting them hands-on and getting the explanation. So those are some of the things that we do. And we have really found, since we changed up and started using this more practical approach, that the caregivers, the feedback we get from them is very positive. They're like, oh, okay, now I understand. So think about whether that's something you could bring into maybe have family education or caregivers, and there's a number of things there. The other thing that we talked a little bit about is we do know that Harry has got a progressive condition. We know with the dementia and the Parkinson's, things are probably going to worsen over time at some point. So it's talking through what some of those things will look like when more intervention is required. What are we going to have to do? I think if people can be a little bit prepared, even if they're not ready to hear it, it's okay. You sort of are helping go down the road with them a little bit there, and that can really help in terms of some of those ethical dilemmas that arise ahead of time. So we're really coming to the end of looking at where we started from, and that is the very important Harry and Sally and what's going on in their lives and all the things that are impacting right now on that. And we have taken our toolbox and now tried to apply those tools, keeping in the back of our mind that when we use one of our tools, that we're hoping to have an impact. For example, our posture and positioning, we know that it sort of hopefully helped his safety so that he's not leaning over and or putting his head back, but that it also helped in terms of nutritional status because he's more efficient now with his eating, and it also made him be a little bit more independent because he could actually get the food to his mouth without getting frustrated. So it increases enjoyment. So those are positive kinds of outcomes. And it's not our one intervention is not just affecting one thing. Changing his food texture, Again, that hopefully is addressing the choking, but that may be causing a little bit of concern in the quality of life for him and for Sally. So again, it's balancing those things out and helping people understand where you're from, and then also being open to negotiate a little bit around these kinds of things and come up with some ideas that are really going to work and that they feel comfortable with. So I think it is always a bit of a dance with all of these different strategies, and where you're going to take them. So it's not just one thing does this, it's one thing impacts and ripples out. The effect can ripple out in a number of different ways. So we're hoping many of them will be positive. Um, and that's sort of it for for us. I think we have a few minutes left for some questions if there are. Um, and this is our contact information if anybody has a burning question that we don't actually get to. We would be open to you contacting either of us with that. So Erin, I'll hand it over to you.
Yeah, thank you. It was a great presentation. There is a Q&A box to the right of your screen, and I have seen some questions come in. And we have about 5 minutes for questions, so we'll try to answer as many as we can. There was a question about what do you mean by transitional foods?
Okay, I'll answer that. So, if you look on the ITSE website, there is an FAQ about that. Actually, just does say that. So, essentially, for a transitional food, we're talking about a food that sort of starts off in a more solid kind of consistency, but changes the consistency. It will change its consistency with when you add either moisture, so in this case saliva, or it also can happen with a bit of pressure or temperature. And so the kinds of foods that we think about in that realm are some of those. I work in pediatrics as well, so a lot of them are those little baby first foods, that munchable types of foods that we offer to them, Gerber stars, the baby mums. But in the adult world, things like popcorn twists or cheese puffs, they do melt in your mouth very quickly. And so that is one type of a food. Other kinds of things are things like ice cream or ice. That starts as a solid, but when you add heat to that, that changes temperature and becomes a liquid. So we do use a lot of those transitional foods as ones, for example, when people are unmodified, but they're at a party, and they may be able to have some transitional foods as part of the party food, whereas normally their diet is maybe more minced or whatever. So look on the ITSE website, and there's definitely some FAQs on that, and it talks a little bit about that texture.
Okay, thank you. Also had a lot of questions about how can we better educate staff and families about dysphagia and the importance of following dietary recommendations or dysphagia management recommendations. Is there tips that you have or resources or training options to help support?
Do you want to start that one, Owenny, and I can jump in?
Sure. No, I think what Janice mentioned earlier about being hands-on, I think that is when Janice and I see the most light bulbs come on, when they understand how their loved one is struggling and why, and then how the texture made appropriately can actually help to make a difference. And then I'm also going to answer the question about like preferred resources for texture modified cooking techniques and recipes. It's included in our handout package in the end. So there are some resources that we've included that have some more like techniques and recipes. But the ITSE website also has a number of resources on tools that you can use for education, like demonstrating the right textures and things like that. So hopefully that your question will be answered by looking at the resources that's going to be shared after the presentation.
Yeah, perfect. I think we have time for one more question. It's regarding hydration, and I got quite a few questions about. Do you have any like innovative approaches to help maintain sufficient hydration for those who require thickened fluids?
And again, I think it would go back to making sure that the drinks are prepared appropriately and then understanding whether the person if they are not liking the texture, or they're having difficulty because it wasn't prepared properly. Sometimes people are overzealous and they make it too thicker than what is necessary, and that can be a factor. So if they're prepared correctly and the person is somewhat okay with drinking them, then having them around, like having them available around them, is important, to be able to access the drinks like freely, and then choosing the ones that they're like that's their favorite. And then again, I think there's lots of evidence around like using a free water protocol. So if they really struggle, then consult with a professional and see if that's something that can be put in place, right? Because if they're able to drink some like thin water, that can really help to improve the hydration status, if they require a thickened liquid. So if that is appropriate, I think that would be a good tip. And then again, like just offering it frequently if they forget to eat and drink, like just having a teaspoon here, a tablespoon there, here and there, and not just wait for mealtime for that to happen. And then the other thing is with medication, like if you're giving them with medication, maybe like push for a few more, here and there, and it can really add up throughout the day. It's definitely not easy. It's tricky. Like I struggle with that a lot too. But there are, hopefully these tricks and tips can help to increase them little by little and meet that fluid goal. And focusing on the higher like water content food, and maybe serving more soups and things like that, can also increase the hydration without actually forcing them to physically drink. Yeah.
Can I add just one comment there? And I know we're
Yeah.
kind of
Yeah,
running out
no,
of
that's
time.
okay.
I also think one thing to just be aware of is sometimes we say thickened fluids. Well, there's a lot, if you look at the ITSE framework, there's a lot of different levels of thickness there. And I think sometimes there's a tendency to go to something that's very thick. And if you actually read the literature on it, too thick can be a problem for people as well as too thin. And it is really important to check and see. We try and go with the thinnest level of thickness that will provide that the therapeutic effect that you're actually looking for. And there are some downsides to use of thickener as well. There's certainly becoming more out in the research. So it is important to think about, are you over thickening? Some hospitals will only provide level 3. They don't even provide level 2 or level 1. So there's those are also things that I think it is, and the thicker that it is, sometimes that's what becomes unpalatable for people and why we run into those problems.
Thank you. That's great. I know we've run out of time today, unfortunately, but I'd like to thank Winnie and Jan for sharing with us this insightful information today. It was a great presentation with lots of really great practical tips. And I'd like to thank everyone for attending today, and thank you for all your comments and questions and feedback. And talking about feedback, we'd really appreciate your feedback. So if you could please take a few moments and answer the survey. It's to the left of your screen. There's a forms option, and if you can please click on it and complete the feedback survey. We do appreciate all that feedback you provide. And I just want to let everyone know, because there's lots of questions about the recording and the resource list. Once the recording is ready, you will receive an email that will include a link to the recording of today's webinar. There's also a summary of key takeaways with a list of resources. And in that list of resources, I asked at registration that you provide like the resources that you really found beneficial, and I've added those to the list too. So thank you for taking the time to complete that. You will also receive an email with a certificate of attendance for today's webinar. So we'll end our webinar now, and I hope everyone enjoys the rest of your day. And thank you so much for your time today, and thank you.